Okay, thanks everybody. Thanks Maggie for the introduction. So pleasure to be here. HealthTO, it's fantastic. I'm ashamed to say that it is my first time here, so it's an absolute pleasure. So I'm going to be sharing tonight on my perspective on the great opportunity that we all have to provide value in the healthcare ecosystem. So I first want to start with probably something that many of you know, and that's just like the size and the enormous scope of healthcare in Canada. So last year in 2018, Canada spent $250 billion on healthcare, some of that private, some of that public. And the alarming thing is that 40 years ago, we spent 7% of our GDP was spent on healthcare. We're now spending 11.5 cents of every Canadian dollar on healthcare. And if you kind of extrapolate and go forward, I mean, 40 years from today, we would be at 18% of GDP. So we all are working together on innovations and technologies and change to sort of begin to bend this curve, because it's simply not sustainable. The other interesting point that it was a real learning for me in the last year is we often think of healthcare in Canada as predominantly public, right? It's funded through the federal government, it's provided through transfer payments to provinces, but that's only sort of 70% of this $250 billion. 30% of it is out-of-pocket expenses and private insurance. So many of you are employed, many of you are entrepreneurs, you're all familiar with health benefits, and this is where the Great West Lifes and the Manulifes and the Sun Lifes of Canada come in and give us that extra umbrella and security net to provide dental and vision, extra coverage on pharmaceuticals, etc. But not deemed purely medical necessary, which is paid for by the public system. And so where we sort of operate in this 30% quadrant, the trends on spend is the same. So basically every 6 to 7 years, on a per employee basis, annual premiums of healthcare insurance are going up. And previous to my other slide, this is also a big concern. Employers can't afford this. This is a huge economic burden. So there's the cost aspect, and then there's also the experience aspect. And so many of us are working on things that are individual-centric, patient-centric. We take the lens of this huge issue of an inaccessible healthcare environment. There are many, many merits of the Canadian healthcare system, but in Canada, 57% of Canadians can't get access to a practitioner same day or next day. And of course, we all know this, the experience is very much provider-centric. We walk to a clinic, we drive to a clinic. We're pretty spoiled in a metropolitan area, but if you think across Canada, it's such a big scope, such a large geography, it's difficult to get to, for many people, difficult to get to centers of care. And this is a report. I've distilled 30 pages of material that was released last Thursday. This is from the Ontario government. There's a council called the Premier's Council on Improving Healthcare. I'll just call out in red just an admission directly from the Ontario government that the healthcare system does not always work efficiently. And then the call out in green, there's an immense growing demand and opportunity to innovate in care delivery, particularly the use of virtual care and apps and ensuring patients can access their own data. So good segue to talk about our company, a virtual care provider. So we are a fully employer-funded health benefit for accessible patient care. If you're familiar with telemedicine, it's essentially a health clinic in your pocket or a health clinic that's accessed via web. So we are Canada's largest virtual care provider. This is by virtue of the number of Canadians that have access to the Dialogue platform. Over 110,000 Canadians currently can access the platform, and that's across 250 corporate clients. So again, because we only sell this as a benefit to corporations alongside private healthcare insurance, we work exclusively with plan sponsors. So the next sort of half of my presentation is just about things that we've seen from our perspective, and I've sort of framed them in a way that I hope they're more just like, here's something that's been working for us, and here's how I think we all can work together to work on those previous challenges of bending that cost curve, improving healthcare, improving accessibility, improving patient-centric care. So the first one, I mean, this one's a bit obvious, right? You can't build something, sell something unless it aligns to trends and needs in the industry. And so I'll just highlight the first one. The CMA, the Canadian Medical Association, surveyed many Canadians, and the vast majority would use virtual visits for appointments if they had access. And the problem right now is not enough Canadians have access to virtual care. The other thing is, building an in-house technology stack. So this has been super helpful for our business. We have a very large engineering and development team, and we're able to innovate in-house very quickly. We're able to take feedback from our customer base, from our future client base, and sort of iterate and improve and move really quickly. Build an operation that drives usefulness and drives breadth of scope. So what that means for us is a multidisciplinary team. So we don't only have physicians, we don't only have nurses, but we have both of those. We have care coordinators, psychologists, nutritionists, and the whole point is to sort of offer this care and then grow out so we become ever more useful over time. And this is just some of the things that's well fitted for telemedicine, not just us, but for other providers as well. I was just talking to my friend Renee about this. I mean, this is super important, and probably many of you in business development do this, and it's so innate to your job. But earning the trust of partners who already have the earned credibility of your clients or prospective clients, right? So for us, we're selling a health benefit, and the insurance carriers, the health consultants, and the advisors and brokerages are already so close to our clients and our prospective clients. So now that we've earned their trust, we can build this distribution flywheel that really broadens the scope of who we get to talk to, which is absolutely fantastic. This one's pretty straightforward. I mean, we're delivering on value propositions, right? And so for our clients, plan sponsors are very savvy, and they understand and they quantify the cost of attracting talent, retaining talent, keeping a healthy workforce. They know their health-related costs. They know their absenteeism costs. And a lot of them are getting a lot closer to quantifying the challenges in mental health and its impact on short-term and long-term disability. So we sell on what our clients already quantify, and then we promise to deliver and show them the return on investment that we previously promised. So this is just an example of time saved by using telemedicine as opposed to driving to a clinic or an emergency room. Build new offerings where current treatments are underperforming. So again, to touch on this public health issue of mental health disorders, I mean, we basically didn't come up with this ourselves. It's really our clients started waving their hands and flailing, being like, we have this huge need. Like, people are suffering. 500,000 Canadians are missing work every single week due to mental health illness. And so we've really bolstered and leaned into a service offering that will really help with this. Build for customer satisfaction. There's probably a bunch of folks in the room that work in SaaS businesses, and maybe some folks in customer success. So we have a team, and they're just constantly delivering and engaging with our clients and making sure that we're selling on we're delivering on what we sold them, and that we're satisfying all of our end users. So we measure NPS. We're putting ourselves right here with, or we're currently sort of scored right here with some of the world's best tech companies, which we're very proud of. And we're being highlighted for having a very great product, quick response time, great interaction with our practitioner care team, and providing excellent quality of care. Be different. So Wello's in the room. There are other virtual care providers. That's perfectly fine. Competition's great for the economy, it breeds innovation, but be different and be very vigilant about what you do and what you don't do. So we often talk to our prospective clients about how we're different and how potentially a different vendor could be a better option for them, and that's perfectly fine. Stay ahead and look around corners. So for us, a great opportunity is, like, we have all these tools now that our tech team has developed that really empowers all of our practitioners day in and day out, and they use on the back end to have these conversations. And a lot of it's automated, and a lot of it's, it's all tech driven. An opportunity for us now is, like, can we take that software and does it fit in situ in other clinical settings, in a hospital setting, in a community care center and such. So some really exciting discussions that we're having on where else we have a use case. And that's all I have. A pitch on our open recs. So we have an office in Toronto, we have an office in Montreal. We've got a huge, ambitious year ahead of us, and so we're staffing across all functions. If any of this was compelling, find us online, find me on LinkedIn, and thanks for the time. Yeah, it's a great question. It's one we get all the time. We have competitors they have both a business to consumer model and a B2B model. We exclusively have gone the B2B route. Some of that is just the philosophy of Canadians and sort of incongruence with the Canada Health Act. We as individuals don't really buy primary health care, and that's perfectly fine. And so we've also worked with some of our partners across insurance and consulting and advising to bolster onto this private sector the way these types of health benefits are purchased. And it's just our sort of line in the sand, or our current strategy, not to sell to consumers. We might decide that that's wrong, and we might be proven wrong in the end. But right now it's just sort of a business decision just to go B2B. Yeah, I think it's a great broad question for a bunch of beers, because it's like we already pay, right? Like, we're in a country that has a fairly robust tax rate, and one of my first slides was $6,800 is spent on every Canadian every year. And so we're collecting funds in income and all sorts of provincial and federal taxes that's being distributed different ways, and it's funneled up through all these systems. So we're already payers. It's just, would you as an individual pay for your own services? I think that's where Canadians are just, the expectation is that, no, I have this, there's an act, all medically necessary services must be delivered to me for free, but it's really not free in the end. What's the secret sauce? That's a tough. Next question.
How would you
No, I totally agree. My colleague Mike's in the room, and he's on our executive sales team. And like I splashed some of those value props, right, of some of the things that speak to employers, and the next slide was a bit on ROI. It's hard when an employer doesn't have all of the data themselves, because you have no starting point, right? I think one really interesting thing, and that we and you need more time in, is can you work with an employer that has X dollars in costs in a year, and can you introduce these new types of health benefits and then evaluate at N+1 and N+2 and see what the trend is of those healthcare costs. I think we're super bullish on having a positive impact on short-term and long-term disability rates, especially with our mental health offering, but it just needs time. Like, health it's not something we can measure in 15 or 30-day periods. We need sort of years to prove this out. So we're right there with you with the challenge. So the first one is, there's a true economic cost to absenteeism in the workplace. And in Canada, the average Canadian misses like 9.7 days of work a year. And so we don't articulate that a benefit like this can ball and chain someone to their desk. But there's definitely, through our surveys, there's a lot of hours saved from the avoidance of a clinic, or going to a clinic or emergency room. And so one of those slides was sort of, on average, people that use Dialogue are saving 3.5 hours each time they use it, because they're like admitting that like, hey, I didn't go to a clinic, I didn't go to the ER. And you know, you add in salary and you add in hours, and you can get a dollar figure. And you know, our calculators online, it needs to be more conservative, but we often approach employers with that and be like, here's what your cost is of absenteeism. It's better if they have it, and then here's what we can reasonably assume that you'll gain back from, you know, productivity hours saved or returned. So that's the first part of your question. The second part, I sort of have to respectfully disagree, because there's a lot of, I mean, as you said, like in Canada, most of the firms are small and medium businesses, but they're all competing for talent. And so many of them like really pride themselves in being a top employer, because they know they're competing with the next guy. And so they're looking for these ways, be it Dialogue or another benefit, to really bolster their benefits package, to say, hey, we're different. You know, we're different from the person next door. That's our experience anyways.